Welcome back to the deep dive. Today, we are jumping straight into what might be one of the most brilliant social enterprise blueprints we've ever seen.
Oh, absolutely.
We're talking about the story of DotGlasses. They took on this massive global health issue, over 1 billion people without basic vision care, and they didn't solve it with a handout.
No, not at all. They solved it with radical product simplification, a truly revolutionary distribution model, and maybe most importantly, a price tag of around $3 a pair.
$3. It's a classic case of what you'd call designing for the constraint.
Exactly. And the scale of the vision crisis it's just staggering. Uncorrected poor vision isn't just an inconvenience. It's this profound systemic barrier.
A barrier to what, specifically?
To everything. We're talking more than 1 billion people who can't get a basic eye exam, can't get affordable glasses, and that translates into hundreds of billions of dollars in lost global productivity every single year.
And if you look at the actual infrastructure, the problem just seems completely insurmountable.
It does.
You see stats like, in a country like Kenya, you might have one optometrist for every 250,000 people. One.
And when you have families living on, say, $2 a day, they are incredibly price sensitive. The established medical system just isn't built for them. It doesn't even exist in many of these places.
Precisely. So that's our mission for this deep dive. We're going to unpack the strategy, the product innovations that let DotGlasses completely bypass this broken system.
Right. We'll look at how they really embraced this philosophy of good enough utility.
And how they built a self-sustaining business model and scaled it into this asset-light, decentralized orchestrator model that's now in over a dozen countries.
So let's start there. Let's drill down on the consequences. Before DotGlasses, what was the real-world impact of not being able to see clearly?
And why were the old solutions, charity and conventional optometry, why were they failing so miserably?
Well, the consequences are severe, especially for the economic future of a whole community. The data suggests that for a child, not being able to see often means failing in school.
It's just full stop.
Full stop. But if you give them glasses, you can boost their academic performance by anywhere from 30 to 50%.
That is life-changing.
It is. And for adults, that translates directly into income.
Makes sense.
Absolutely. If you can't see, your efficiency just plummets, whether you're, weaving or doing some other kind of fine motor task. Research shows an adult's income can jump by 20% or more just from getting a pair of glasses.
So this is an aid. It's economic enablement.
It's economic enablement, and it's also safety. In a place like India, some studies have linked poor driver eyesight to 60% of all traffic accidents.
Wow. Okay, so we have this massive quantifiable need, but the traditional solutions just collapsed. Why did the charity models where you just donate glasses for free, why did that fail?
Two big issues: dignity and logistics. On the charity front, you often got donations of old, secondhand, mismatched prescriptions.
Things people wouldn't want to wear.
Exactly. People will not wear glasses that make them feel stigmatized, even if they're free. So adoption rates were terrible, which destroyed any potential impact.
And the logistics sound like a nightmare.
An absolute nightmare. Trying to deliver thousands of individual prescriptions to remote areas, it requires sorting, inventory, long waits. It just doesn't scale.
And the conventional medical model was, what, just too expensive?
Way too expensive. Think about it. Traditional optometry needs certified professionals, optical labs, these big 4-opter machines that need electricity.
The things that cost tens of thousands of dollars.
Right, and the glasses you get at the end might cost $50 or more. That infrastructure doesn't exist in these communities, and the price is completely out of reach. That's the wall that DotGlasses had to get around.
Which brings us to their solution. It's just so brilliant. Given that failure of both charity and high-cost medicine, how did they pull off this, what is that, an 18-fold cost reduction?
And at the same time, create a product people actually wanted to wear.
Yes. So let's unpack the product itself.
The design is just a marvel of simplicity. They built a modular system around a single universal frame.
One frame.
One frame. It's one size fits all, it's adjustable, and it's made from this super sturdy injection molded plastic. They even brought in engineers from MB Tech to get the quality right.
And that detail, working with a high-end partner like that, is so important. It helps them avoid that basic design trap.
It does. It gives it what they call the dignity factor. The frames look modern, they're neutral, they're robust, they have to look good.
Of course.
But the real genius, functionally, is the flat pack design. The entire pair of glasses can be shipped in 6 lightweight pieces.
Which minimizes space for transport.
Exactly. And they can be assembled right there on the spot in about 2 minutes. No special tools needed.
And I read that this whole modular concept is protected by IP. Why is a patent so important for a social enterprise like this?
It's vital. The IP on the adjustable frame and the lens concept gives them control over the ecosystem. It protects the quality, which is essential for building customer trust, and it stops low-quality copycats from flooding the market and undermining everything.
Okay, and here's where it gets really radical. The good enough vision concept. For decades, optometry has been about chasing perfect 20/20 vision. DotGlasses just threw that out.
They did, but that's the core strategic decision, right? The goal isn't 20/20. It's correcting vision enough, say, to 20/40 to make a profound difference in someone's daily life.
So instead of dozens and dozens of lenses,
They use a standardized set of just six interchangeable lens powers.
Six.
And those 6 powers cover the vast majority of common refractive errors. The medical consensus is basically that getting someone from severely impaired to good enough vision gives you 90% of the benefit for like 1% of the cost.
6 lenses. That just simplifies the entire supply chain exponentially.
And the diagnosis. They created this proprietary diagnostic tool, simple eye charts. Crucially, they included e-charts and pictograms for people who are illiterate.
So no need for the expensive machines.
No four-adapters, no certified optometrists. A local person, a teacher, a shopkeeper can be trained in about 1 hour.
1 hour.
1 hour. And they can test someone's vision and dispense the correct glasses immediately. No electricity, no waiting for weeks. It's an instant solution.
Think about that. An hour of training and a local entrepreneur can fundamentally change someone's life and their economic potential.
And that simplicity is what drives the cost down. Production and distributing costs are around $1, which leads to that end-user price of $3 to $8.
So let's move to the business model. DotGlasses isn't a charity. It's a low-margin, high-volume, for-profit social enterprise. Why go for-profit if the goal is social impact?
That choice is everything. It's how they solve the dependency trap.
The dependency trap.
If you rely on grants, you always have a ceiling on your scale. The second the grant money runs out, the program just stops. But by designing this high-volume, low-margin model, where every single part of the value chain is financially motivated, well, that's how you get long-term, self-sustaining viability.
And that financial incentive for the local partners, that's really the key to their role as an orchestrator, isn't it?
Absolutely. The local micro-entrepreneurs, they earn a clear profit, usually around 70 cents to $1 per pair.
So they have buy-in.
They have real buy-in. It ensures that someone in a remote village has an incentive to go door to door. This decentralized profit motive, not just altruism, is what fuels the scale. And we saw them hit financial sustainability around 2023. They went from prototypes that cost $70 down to covering all their operating costs through revenue.
And to get that volume, they needed this asset-light distribution strategy. They don't own clinics or anything. They enable others with these portable vision kits.
The vision kits are the centerpiece of the whole orchestrator model. They're just these portable toolkits you can carry on in a backpack. And it has frames, all 6 lens powers, testing materials, enough to serve up to 120 people.
So they keep their own assets minimal.
Which lets them focus purely on product quality, standardizing the training, and coordinating all their partners.
So what are the main channels they use to get to that last mile?
They use 3 core channels, all powered by the kits. First, you have the micro-entrepreneurs, locals trained in that 60-minute module who act as mobile opticians,
Going door to door.
reaching the most remote people. Second, you have fixed points. So partnerships with existing trusted places like a local pharmacy, a clinic, or a school. They just add vision testing to what they already do.
Smart.
And third, vision camps. These are larger community events, usually with an NGO or a government partner, where they can serve hundreds of people in a single day.
It's just so impressive how this whole model empowers the local community. It sounds like most of the money actually stays right there.
That's entirely by design. DotGlasses is the facilitator, but the profits stay local. About 70 to 80% of the total value generated from sales remains in that local economy, paying the micro-entrepreneurs and the partners.
That partnership with the UNDP in Ethiopia is a great example.
A perfect example, equipping 140 local entrepreneurs. That's the orchestrator role in action.
Okay, so if we step back a little, the success here wasn't just a cheaper frame or 6 lenses. It was about creating this whole operational system.
Yes.
So what were the key non-product lessons learned for scaling something like this in a low-resource setting?
I think the biggest lessons all center around building what you might call transactional trust. First, They learned the importance of trust and perceived value.
Right, because just giving them away for free didn't work.
It was proven to fail. By charging just a small price, people actually value the product more. It professionalizes the whole transaction. And letting local partners put their own brand on the eyeglass pouches, that builds deep community buy-in.
And the second lesson would be the partnership strategy itself. They had to be so flexible.
Incredibly flexible. Being a successful orchestrator means you have to tailor the incentives.
Yeah.
An NGO partner, they need metrics on outreach. A local retailer, they care about revenue margins.
But DotGlasses provides the same standard tool for everyone.
Exactly. The product and that 60-minute training module are standardized, but the partners can leverage their own existing networks and local knowledge for maximum impact.
And finally, just being adaptable.
Constantly. It means using, visual pictogram-based training for communities with low literacy, or making sure the frame designs are culturally acceptable,
And I saw they won some big awards, a Red Dot Design Award.
which was strategically crucial. That kind of external validation is what helps you attract those higher-level government and institutional partners you need to get to massive scale.
This whole journey is just such a powerful case for market-driven social impact. DotGlasses used IP, radical cost reduction, and this asset-light, decentralized model to become financially sustainable.
And in doing so, they prove that you can drive this profound social impact, better education, more economic opportunity, not through endless charity, but through smart, high-volume market principles.
It's amazing.
And what's really fascinating here is how the model works by minimizing its own assets and maximizing local networks. DotGlasses is just the orchestrator. They design the perfect standard tool, and then they enable thousands of existing partners to use it.
So that raises a pretty big question for you, the listener.
It does. If this asset-light, partnership-based approach, where an organization just focuses on designing the tool, standardizing quality, and enabling local partners, if that can solve vision care, could it be the most sustainable way to tackle other massive, neglected global infrastructure problems?
Like what?
Well, think about access to basic dental care or simple, low-cost, clean water purification technology at scale. Could this be the blueprint?
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.